Okay, so this is the review session, review material for the upper extremity final exam. So this is the final review stuff for the upper extremity final exam. The upper extremity final exam, like the work one, is going to be ExamSoft. It's going to be live on Wednesday morning, the 9th. Um, Again, like the last one, it's going to be questions where you have to type in your answers. No multiple choice, no fill in the blank, just be questions, and you have to write in your answers. There'll be 10 of these kinds of questions related to splints, edema, complex regional pain syndrome, nerve pathways, and the myotones. That was all in that week 9 lecture. There'll be 5 questions related to a case. That case will have 2 different diagnoses in it. Those questions related to the case will focus on treatment protocols, guidelines outlined in the treatment boxes, including appropriate splinting, exercises, manual therapies, and diagnostic tests. Those diagnostic tests are really focused on that. I think it was the week 9 stuff, all on the stuff that we did all our sims on and you did your final practicum on. So around carpal tunnel, PTS, all that sort of stuff. There really was no diagnostic test the last few weeks that's significant. The Bonnell-Littler test will not be on the final exam, so don't have to worry about that. But all those basic ones, so a lot of other stuff that's really not test related on this one. You get into all that stuff that Andrea was lecturing on. In particular, it will cover weeks 8 through 13, everything from after the midterm on. It's not a comprehensive written final exam, it's just from weeks 8 through 13. There's nothing on wounds. And she did that wound lecture and the wound lab, just too in-depth, kind of more specialty kind of stuff. Not going to hit you with any of that, but the stuff on edema that she did cover that week, especially the photo images that were posted around showing you different types of edema and the characteristics on moderate and severe and all that. Definitely need to know that, along with the general treatment principles for edema, real general basic stuff. That's all in there in the week 11 stuff on the modules. The splints, need to identify the diagnoses for each splint. What am I talking about? Talking about that chart that we did in the lab, and you like to put all those splints. Look at that chart. There's a chart there with the answers, it has the splint, and it has the diagnoses. Basically, you need to memorize the diagnoses for each type of splint. Edema, talked about that, the characteristics for each type of edema, and those basic treatment principles. Check out those pictures. Week 11, know that chart well, know the splinting chart well. Both those charts, just need to kind of memorize that. Complex regional pain syndrome, the characteristics, the treatment principles. That was that last lecture, week 13, with the wrist fractures. Just know the basics of that, how to describe it if you see it, how to basically treat it. Potential areas of nerve impingement. This is from the neck down to the hand. Remember we had that photograph of the woman with the outstretched arm, and we did the median and the radial, median and the ulnar nerve pathways. This is all that week 9 stuff. You need to know that for the median and the ulnar and the radial, especially the median and the ulnar. Where is it potentially impinged? Coming all the way down from the neck, into the collarbone, the shoulder, the elbow, forearm, and wrist areas. Those nerve myotones related to function. Really look at those charts carefully on week 9. The different functions. People are getting confused. Don't get into this blanket kind of thinking that the median does all the flexion, the radial does all the extension, and the ulnar doesn't do much. Ulnar does a lot, especially related to the thumb. Check all that out, know that well. There will be questions related to the function, as in the ulnar nerve does which motions, which functional tasks for the thumb, that sort of stuff. Basic treatment guidelines, principles, those treatment boxes, especially the early stuff that I did, week 8, week 9, the repetitive strain stuff. I think you know that really well after your sims and all that. The digit thumb arthritis stuff, Radial fractures, basic stuff on radial fractures. Know that, those treatment boxes. Really drill down, especially with the Andrea stuff. She has those down and dirties, all those really simplified treatment protocols. Know that for your wrist fractures, your digit fractures, flexor tendon injuries. Again, nothing related to wounds. For all diagnoses, focus on treatment boxes, especially down and dirty, or simplified treatment protocols. I would start there, get the simple stuff, and then if you have the time, go into the more in-depth stuff, especially with the Andrea stuff, which I think is going to be the challenge for most people. I think weeks 8 and 9, maybe except for the nerve stuff, you guys know really, really well. So the other stuff, try to get the basic stuff and then kind of grow from there. I'm not going to ask you a lot of nitty-gritty detailed questions about her lectures. Just wouldn't be fair. We didn't have the, in-class content like we did in previous years, and it's just so dense what she's teaching. But definitely hit the basic stuff you need to know from what she was reviewing and what she talked about. Key dates, the hand constructions, if you haven't already done it, that's due 12/2, AOE 12/6, final exam 12/9, and I just posted doing a live Zoom session. We're going to jump in and ask questions. I'm just going to be going through these PowerPoints quickly again, but it's really just an opportunity for you to ask questions, just to listen to other people asking questions before the final exam. I'm going to do that Thursday the 3rd, between 8 and 10 a.m. I'm available for email questioning, just about around the clock, and get back to you pretty quickly. And we can do a Zoom session too if you want, really anytime, if you just can set it up. I know you have crazy work schedules and all that, so keep that in mind as well.